Hi, my name is Andrew Clark, and today I'm going to be talking about a rheumatological condition known as Sjogren syndrome. Sjogren syndrome is an autoimmune disease characterized by the dryness of the mouth, eyes, and other mucous structures within an individual. This is often due to the lymphocytic infiltration of the exocrine glands and secondary gland dysfunction. This means that the exocrine glands, such as the liver, pancreas, salivary glands, and many others, aren't secreting fluids into the digestive tract like they normally should be in an individual that is not infected with Sjogren syndrome. There are two ways to classify Sjogren syndrome. The first one is primary, and the second one is secondary. Primary is an isolated case where that is the only rheumatological condition that is present within the patient. Secondary, on the other hand, there are other rheumatological conditions that are affecting the patient at the time of the diagnosis. The true etiology or onset of Sjogren syndrome is unknown to scientists. However, it is known that a genetic strand of HLA-DR3 is often present within individuals that have this disease. Also within this condition, T cells and B cells will invade exocrine glands and cause an inflammatory or swelling response. This ultimately leads to glandular dysfunction. There are many signs and symptoms that appear both early on and later on within the disease. First, the early signs and symptoms are mostly involving your eyes and mouth, and they include irritation, photosensitivity, and keratoconjunctivitis, which is the inflammation of the cornea and conjunctiva of the eye. Also, for the mouth, there are difficulties swallowing within a patient, as well as salivary gland dysfunction and tooth decay. As the condition continues to progress, we see many more signs and symptoms within a patient. These include a decrease in fluid production of the skin, nose and throat, and respiratory tract, a loss of hair, and exocrine gland enlargement. And finally, within patients of Sjogren syndrome, you'll begin to see a lot of extraglandular problems. These include musculoskeletal symptoms, including a decreased range of motion and pain, Raynaud's phenomenon, low-grade fever, and the quickness to fatigue. If antibodies to SSA or SSB are highly present, it is often very indicative that a patient will have Sjogren syndrome. A tissue biopsy can also be done of exocrine glands to see if the patient is presenting with this condition. As a physical therapist or medical professional, there are many things that you can do to medically manage and treat Sjogren syndrome. The initial treatments are usually aimed at decreasing dryness and the musculoskeletal symptoms within a patient. As stated before, these include decreased range of motion and pain of certain joints, muscles, tendons, or other tissues. Drugs such as methotrexate and hydrochloroquine are usually administered to a patient with Sjogren syndrome to decrease these symptoms. For the best results in treatment, a patient and doctor would also want to avoid drugs such as antidepressants, opioids, diuretics, and hypertension meds. All of these will increase the dryness within a patient, which is not what we are trying to do. In the end, physical therapy plays a very important and vital role in the prevention of progression and the overall treatment of patients with Sjogren syndrome. According to Physiopedia.com, a study by scientists was done that shows that Sjogren's patients benefit from moderate to high level exercise, which is often done in physical therapy exercises and prevention techniques. In addition, as stated before, patients with Sjogren syndrome have many musculoskeletal symptoms that contribute to their signs and symptoms. These include pain, a decreased range of motion, and inflammation of certain tissues within the body. Different physical therapy techniques, such as manual therapy and exercises, can be given to decrease this swelling, increase range of motion, and work to decrease pain. Thus, making physical therapy a very important factor and piece of the puzzle in treating a patient with Sjogren syndrome. I hope you found this video useful and have a great day. Thank you for watching.